Welcome, everybody. Thank you for taking time during your summer to spend time with us. I'm really excited about today's presentation and want to kind of get right to it. Okay, so you've given me a ton of information, super helpful. I appreciate your engagement in this. I'm happy that you're here. And now I'm hopeful that our presenters are going to give you a ton of information. I know Allison Metz for years. I consider her a dear colleague, and I'm just excited for her to be here. You all know her from her work in implementation science as a global leader in this space, and she's brought her dear friend and colleague Christina Dobson around to be part of this. They've worked together on a number of projects. She's director of data and performance at Ready for School. And I'm going to let them introduce themselves because much like me, they don't love it when people read their bios. So thank you, ladies, for being here. And I'll turn it over to you.
Great. Thanks so much, Christina. I might introduce myself first, and then I can bring up the slides while you're introducing yourself. So yes, I'm Allison Metz. I'm so happy to be with you all today and really honored to be invited to talk to this great group. And my congratulations as well for folks that have already submitted. That was an amazing Menti result. As Michelle said, well, I don't know how Michelle, what you said about where I was, but I'm at the University of North Carolina at Chapel Hill. I'm a professor in the School of Social Work, and I direct a center there called the Collaborative for Implementation Practice. Prior to that, I was the director of the National Implementation Research Network for many years. And so I've really committed most of my career to implementation science. And I work mainly in the fields of child welfare and early childhood and children's mental health and juvenile justice. But hope that some of the examples that we can bring to you today feel really relevant in your work. And with that, I'm going to turn it over to my incredible colleague, Christina, to introduce herself.
Thanks, Allison. I am also really grateful to be here and excited to hear about the really important work that you all are doing. So thank you for the opportunity. I am Christina Dobson. I'm the Director of Data and Performance at Ready for School, Ready for Life, which you'll hear a little bit more about a little later on. And before I was the Director of Data and Performance, I was the Director of Navigation Services, so a little bit more closer to the programmatic side of things. So some of the examples that I'll be sharing with you later relate more to that aspect of the work. So looking forward to talking with you today, and I'll pass it back to Allison.
So today we're going to spend some time talking about implementation strategies. Very exciting topic. But it really is because so many times when we're implementing evidence-based programs or really any innovation, what we are struggling to do is to be able to match the implementation strategies that are well aligned with either the barriers that we're facing for implementation or really our ability to enhance what those enablers are for implementation. And oftentimes we select implementation strategies that are just available to us, are feasible to use, are affordable, that we feel really comfortable with, but they might not necessarily be the right implementation strategies. So we have a tendency to overuse certain strategies like training because we know how to do it and because it's available to us. And so with this, hopefully today, what we'll talk through is how critical it is to be able to really identify potential barriers and enablers to implementation so that we do a really good job selecting and tailoring our implementation strategies so we can get to those positive implementation results. And so the specific objectives we have for our time with you are we're going to give some examples of implementation determinants. Those are really just those challenges and enablers to implementation and what it means to really, again, correctly match implementation strategies to those determinants. We'll really describe the importance of, again, accurately identifying any challenges that we have and developing an implementation plan that really supports that alignment between the strategies that we're using and any sort of, again, potential barriers or facilitators to the work that lies ahead of us. The way that we have it set up is that I'm going to do a little bit of the talking for about a half hour or so, talking about implementation strategies. And then I'm going to spend some time talking with Christina using her work at Ready for School, Ready for Life around implementing evidence-based programs, kind of a case example for us to bring alive in terms of what it means, again, to be able to appropriately diagnose the challenges that we're having and making sure that we're picking the right strategies. So before I just dive into all of that, I want to just spend just a couple of slides kind of maybe taking a step back and framing what implementation science is. I'm sure you've heard about this in your last couple webinars, because I know you've had some really great speakers, but just for the sake of kind of doing some stage setting, I want to define what implementation science is, which is the study of factors that lead to uptake, scale, and sustainability of programs and policies and practice that have evidence behind them. And that really the purpose of implementation science is to create a bridge between research evidence and real world settings so that we can improve both service delivery and outcomes for the populations that we work with. So I'm sure that's something that you've heard before. And then the other thing I wanted to describe is how both implementation research and implementation practice really contribute to the science of implementation. So implementation researchers are identifying those evidence-based implementation strategies that I was talking about. So implementation researchers study what are those variables that affect implementation, what are those strategies that will most likely lead to more effective, efficient, and timely implementation. So all sorts of things that we've learned from implementation researchers. I gave that example of training being an overused implementation strategy. Well, implementation researchers are the group of individuals that have really shown us that it can be overused and that there's other strategies, whether that's coaching or audit and feedback, that can be really helpful to build skills and really make sure that practitioners can use those skills in everyday settings. And then you have implementation practice. And that's when individuals who work in a practice setting try and take what we learn from implementation research and apply it and adapt it in different service contexts to really be able to get to outcomes. So if, for example, implementation researchers kind of identify that certain coaching strategies are really important for achieving fidelity to an evidence-based model, in the world of implementation practice, we're testing out those coaching strategies, we're adapting them, we're figuring out what's feasible in terms of our finances and our human resources. So really the science of implementation is built through kind of a virtuous cycle between implementation research and implementation practice. So hopefully that makes sense. And I think that when I think of implementation strategies, the topic that we're talking about today, I think it sits directly at the nexus of implementation research and implementation practice, because implementation researchers are identifying those strategies that really seem to help with uptake and sustainability and scale. But in the world of implementation practice, we're still kind of trying those things out in new contexts and seeing, oh, does this stick? Does it work here? And or do we have to modify it for the setting that we're working in? So implementation strategies and the tailoring of them for specific service contexts really does sit at this nexus of research and practice in the field of implementation. So what is an implementation strategy exactly? So I've given some examples of what that may be, but you can see here a definition from Byron Powell and colleagues at the top of this slide that implementation strategies can be defined as methods or techniques that we use to enhance adoption, implementation, sustainability of programs or practices. There are taxonomies of implementation strategies in the field of implementation science. So the ERIC compilation that was actually led by Byron Powell, who we're citing on this slide, has identified 73 implementation strategies that are commonly used and testable in everyday work. But what we do know is despite the identification of a range of these strategies and building evidence behind them in the field of implementation research, there's still more guidance that's needed on how to do that appropriate match that I was talking about, matching the strategy with any known barriers that we might face for implementation. And so our job in kind of real world settings every day is still really hard in terms of, the science has brought us so far, but we still have to be able to make that appropriate match. And I'm going to kind of walk through how it is that we do that over the next set of slides. So there's also different types of implementation strategies. So sometimes we can use a discrete strategy, like a reminder message or supervision, or how it is we provide feedback. And that's a single action that we take. And that can be really helpful when we're supporting implementation of programs. A lot of times we're working in large systems, though, even implementing one program might require kind of really transformational change in that system. And when that happens, we need to develop packages of strategies. So we often see these combination of implementation strategies that people are testing. They might be testing 4 to 6 implementation strategies at the same time that are addressing different potential barriers or enhancing different enablers. So when we go through examples today, we'll be looking at kind of discrete implementation strategies just for the sake of illustration, but definitely in kind of, real world service settings, we're often kind of packaging strategies because life's never that easy that one implementation strategy will lead to sustainability. We typically need to look at a few different strategies. Because there's so many strategies, also just wanted to share that there have been compilations of strategies developed through concept mapping and other methods that have been used to really try and kind of think about what are the different types. And the reason that that's important is if you are thinking of developing a package of strategies, you may want to make sure that you have strategies from these different categories. So for example, here you'll see kind of a compilation of strategies that looks at 6 categories: strategies that help us plan, strategies that help us kind of educate practitioners or other stakeholders or partners, financial strategies, any sort of restructuring strategies, things we may need to do at an organizational or systems level around role, for example, quality management strategies, and then policy strategies, which are really more about that kind of outer context, things that really kind of provide those like legislative levers or other types of policy or budgetary levers that we might pull in that kind of outer context. And then here we'll get a little bit deeper, but I've always liked this visual. It's based on a few different visuals, starting with Enola Proctor's kind of seminal article in 2011 on implementation outcomes. There's an update on that article actually that just came out yesterday, and I just heard Enola talk about it a couple of weeks ago. But basically, there's kind of a simple logic, or kind of I think a really elegant logic to implementation science and how implementation strategies relate to better outcomes for the populations we work with. So just this idea that we have an evidence-informed program or practice that we're implementing. We know that we're going to experience potential barriers to implementing it. We also know that we might have constructs that are enabling of us doing that. We want to enhance those and strengthen those. So we choose implementation strategies to be able to kind of get at those barriers or enhance those enablers. And from that, we hope that we produce better implementation outcomes. The kind of very typical implementation outcomes that we look for are acceptability. So that means that there's great buy-in for something, appropriateness, that there's a good fit, a good contextual fit, feasibility, we can pull this off, reach, we can get to the population that we hope to get to and make a difference, fidelity, we can do this as intended, we can do that consistently and with quality. And then some other implementation outcomes that are also really common are around sustainability, cost, and alignment. And the idea is that the stronger implementation outcomes we have, the better our service delivery is. If folks are really bought into something, it's feasible for us to do, it's a strong contextual fit, we're showing fidelity, that we're more likely then to have high quality service that then produces client outcomes. And here with this example, there's just some sample client outcomes that we might be looking for. So I want to take you through some examples that are a little bit deeper than that visual that I just showed, and kind of walk through kind of, again, how it is that we choose implementation strategies. So you'll see some kind of variables in this flow chart essentially on the slide. And so strategies are, those strategies that we choose to be able to, again, address barriers or enable facilitators. And the other thing that you see here is this word mechanism. And I just wanted to explain what that means. In the field of implementation science, there's a heavy emphasis on this concept of mechanisms of change. And a mechanism of change is simply the process or event through which an implementation strategy operates to achieve its desired implementation outcome. And I'm going to give some examples of that so it doesn't feel really abstract to you. Both mediators and moderators are at play, but I'm making this a little simple and just using moderators here. And those are any factors that may increase or decrease the level of influence of the implementation strategy. And then we have both proximal outcomes, which are more short-term outcomes, and then the distal outcomes. And here I'm going to focus our distal outcomes still around an implementation outcome, but often we can think of our distal outcomes as related to population. But for the sake of really honing in on implementation, I'm going to really think again about our long-term outcomes as still related to implementation. So we're missing one key element on this slide, but you'll see in a little bit what that is. But just to start off with some simplicity, say that we wanted our implementation outcome to be improved fidelity, that we have real variability in the fidelity of the evidence-based program that we're delivering. So what strategy might we choose to implement that? Well, we might decide that we want to do fidelity check-ins with practitioners, that we think that it's really important to be able to kind of look at their fidelity data on an individual basis and really spend more time having these check-ins with practitioners. That mechanism of change, we think that doing that fidelity check-in will increase awareness, self-awareness of practice skills by practitioners. So that mechanism of change, again, is the process or event through which we think the strategy will be effective. So we think we're going to use this fidelity check-in strategy, and we think the process through which it will be effective and improve fidelity, that distal outcome, is that it's going to increase awareness of practitioners around their own level of skill. We believe, however, that might be moderated by the quality of the relationship between the practitioner and the supervisor that's doing that check-in. So we think that the strategy of a fidelity check-in, the influence of it on that distal outcome of improved fidelity, that will either be decreased or increased depending on how good of a relationship the practitioner has with their supervisor. So if we kind of take the moderator out of it for a moment, we think that fidelity check-ins increase awareness by the practitioner, and then the practitioner would then commit. So the proximal outcome would be greater commitment towards improving their practice. And that would then move to this distal outcome of improved fidelity. So this is a very common way of looking at implementation strategies and outcomes. So let's do this again. And I've added something here. I've added the word determinant. And the reason I didn't start with that is because often we are choosing our strategies without understanding the determinant. So when I gave you that example, I jumped from, oh, we want to have improved fidelity. Let's do fidelity check-ins. Sounds totally reasonable. It's very, very reasonable. I could sit in an implementation team meeting and say, yes, that sounds perfect. Let's do that. But often what happens is we don't understand what the actual barrier is, right? So we just kind of jump to that strategy because there showed some logic to it. Here in this example, we want to have improved fidelity. The determinant, we've now kind of gone and we figured out, okay, what is the real barrier that's being faced? Well, we find out that practitioners, and I don't know, I put the word participant here. I should have the word practitioners report that the intervention is really complicated to use with families. So we now know that maybe we're struggling with fidelity because there's a complexity to the intervention and that practitioners are kind of struggling with that complexity. Well, okay, that means that fidelity check-in strategy, that still makes sense. Because if in fact that it's that the intervention feels really complicated to the practitioner, they probably do need to have increased time with their supervisor, checking in about fidelity, kind of getting a plan together to be able to improve their own practice. So that makes sense. So we've added the determinant and kept the rest of the example the same. And now let's think a little bit differently about this example. So what if that wasn't the determinant, right? So what if there was something else going on? Well, we know that strategies must be tailored to the local context. They must be tailored to whatever is the potential barrier to implementation, or again, something that could enhance a strength that's already in place, an enabler to implementation. And that really what we want to do is we want to remove those obstacles that are impacting implementation within the context that the intervention occurs. So really being able to identify that determinant really well is this critical part about matching strategies to implementation outcomes. I think you all have been introduced to the Consolidated Framework for Implementation Research, Laura Damschroeder's framework, the CIFR, as it's commonly known as in the field of implementation. And recently there's a 2.0 version that's come out. I'm not going to spend a ton of time on the CIFR, but I do have this slide because using a framework, a multi-level framework, can help us figure out where is the challenge. Okay, we want to have improved fidelity. What's really going on here? So think about the CIFR as just one example. Other frameworks could be used and other strategies could be used to really identify the barrier. This is just one way of doing it. So if in the CIFR, we take a look and we say, does it have something to do with the innovation itself? And that example I just gave, it did, right? It was the complexity of it. People thought, ooh, this is really complicated. So the challenge was sitting at the level of the innovation or intervention. It could, though, be about the inner setting or the outer setting. So it could be a context issue. So in the inner setting, it could have to do with organizational culture, resources, people's attitudes towards change. In the outer setting, it could have to do with finances. It could have to do with policies. In terms of the individuals involved, it could do with kind of good old fashioned the need to support behavior change. Is it about people feeling capable, that they have opportunity to do the work, that they feel motivated? Is it a process issue? Have we not done enough planning? Are we not leaving enough time for reflection? So thinking about that, let's do this example one more time. So we want to have improved fidelity. So we're keeping that distal outcome. But now we've looked at, we've used potentially the CIFR or some other framework to take a look at, well, what is really the issue here? And in the last example, we made it about the innovation, which meant our strategy around fidelity check-ins still made sense. But here we have a different determinant. We now find out that what's going on here, why we maybe have lower fidelity, is that internal policies do not incentivize fidelity to the model. This is incredibly common in lots of public systems that have internal policies, have standards of practice. So public systems might contract to provider agencies to deliver an evidence-based program, and that provider agency is looking to be able to achieve fidelity, but they're also held accountable at a policy level or around standards of practice for doing things that might be at odds with the intervention. So it could be that a different assessment is needed, or how visitation is handled looks different. That would be a child welfare example. And so this concept of policy practice misalignment is very common in terms of why we might be struggling to achieve fidelity. So in this case, a fidelity check-in with practitioners probably isn't the right strategy. So booster trainings or coaching or working with supervisors to support fidelity is probably not the right solution, because this is really about policy practice misalignment. So what we are suggesting here is that the strategy is a policy practice alignment review. So we get very detailed in understanding what are the fidelity requirements, what are our internal policies around service delivery, and where are those things, where is there a tension between those things? We think doing so will increase knowledge by multiple stakeholders about what's disincentivizing fidelity. So that's our mechanism of change. We think that we're going to set this strategy in place, and the process by which that strategy will operate and get us to improve fidelity is by increasing knowledge. So now people have a sense of what's really going on. One of the things that might moderate, though, how helpful this strategy is how good we are at communicating about it. So sending an email, for example, might not be, a robust communication strategy. So if we have not so great communication, that may decrease how effective this implementation strategy is. But say we do have good communication, we think then that those policies would be revised and that they would strengthen the alignment, and that in doing so, there'd be greater clarity on how to move forward, and that we would end up getting to that improved fidelity, albeit through a very different path than doing fidelity check-ins with practitioners. This is more of a strategy that has to do with context and allows us to really create an enabling context. So it's just a good example of how it's really, really critical for us to match those strategies to the barriers we face. And if we pick strategies that have nothing to do with the barrier, we end up not getting to those implementation outcomes. Finally, I just wanted to share a little bit about the fact that one of the other things that's challenging to us is that the barriers that we may face are sometimes hard to see. Sometimes they're frankly invisible to us, because there are things that are much easier to identify. So in this model, this is the Water for Systems Change framework. You might be familiar with the systems iceberg, very similar. It's the idea that there are things that are highly visible. In the systems iceberg, it's like things that are above the waterline. I can see that, I can measure it. So in implementation efforts, we often focus on things that are highly tangible, things we can see and measure. So those kinds of things are very explicit. In this example, they're things like resources and practices and policies. But we also know that there are things that impact implementation that we don't see very clearly. So things that are potentially semi-explicit, and you could see that middle row that has to do with relationships, connections, power dynamics. And then at the very bottom, there are things that are totally implicit. And if you work on implementation teams, we've all sat in meetings before where we've kind of left the meeting wondering, ooh, what was going on in that meeting? I thought we were all on the same page, but it doesn't feel like that way. And that might be because people are bringing different mental models to the work. They have a different understanding of why we're doing what we're doing, different sense, different feelings around what our underlying assumptions for change are, different implicit biases, different sets of values that we bring to the work. And these are the things that we have a lot of trouble seeing. So I just want to focus, there's just about 3 or 4 slides on this. I'm going to move through them kind of quickly to make sure I have time with Christina. But I just wanted to mention that we do at our center a lot of work around the concept of trust and implementation, or trust and evidence use. And trust is one of those things that you can't often see, or there's assumptions about relationships. There's assumptions about trust. So we've done some work to understand from stakeholder groups that are involved in implementing evidence-based programs in child and family service systems. How do you know that you're in a trusting relationship? So people have shared these things with us, that they know that they're in a trusting relationship when people have comfort asking for help, when they have the capacity to stay in a difficult conversation or a difficult situation, when they demonstrate empathy, when they demonstrate vulnerability, when they're authentic and honest and credible in their conversations. these things are hard to pin down. They're hard to measure. They're also hard to produce, because if we want to produce trust as one of those implementation outcomes, how do we really get there? Well, we've done some work on this, and we believe that if we can produce trust, that people will feel more capable and motivated, that they will have greater opportunities to work together. And those words, capability, motivation, and opportunity, in those first 3 dot points, those are mostly the levers of behavior change, right? Behavioral scientists would say, oh, we have to feel capable, we have to have opportunity, and we have to be motivated. Well, how do we produce those things? Well, we think that actually being in good relationships with those that you're implementing produces those things, at least partially. That then leads us to communicate more, collaborate more with each other, and that kind of cohesion that we then develop would lead to resilience in implementation when we face challenges. The more cohesive our network is, the more cohesive our implementation team is, the more resilient we'll be in the face of implementation challenges. And that would lead to greater sustainability, and then hopefully improved and equitable outcomes for the populations that we work with. So we believe that you can produce trust. We believe that you can actually foster trusting relationships. And so we think about, are there implementation strategies, just like those other ones I was just sharing, policy, practice, alignment, fidelity check-ins? Well, are there deeper strategies that we can put into place if we diagnose that trust is an issue? We think there's 2 types of strategies: relational ones, where we build trust by strengthening the quality of the relationship, the mutuality of it, the reciprocity of the interactions that we're having. And then there's also technical strategies that build trust by demonstrating that we're reliable, that we're competent, that we'll be there if we said we would be there, that we'll show up, that those are also things that build trust. For the sake of time, I'm just going to show these slides and note that we are currently, through a research project, testing different strategies that fall into the relational category and different strategies that fall into the technical category. I'm going to give an example in a moment around co-learning. So I'll just share briefly that co-learning is a strategy that we use to build trust by ensuring that we make space for all of the stakeholders involved and partners involved in a project to learn from each other's experience and expertise, so that we can enhance the value that we all feel about each other's contribution to the work, and that we can all kind of move forward in a space kind of equally valuing the contribution that different team members or stakeholders have. And these are some examples of technical strategies. One thing that's kind of interesting is how frequently we interact with folks builds trust. So short meetings that happen more often are actually bigger trust builders than kind of big, long site visits or things like that that happen less often. Just a little tip. But I'm happy to go into these, and we have a lot of open source documents that describe these strategies in detail. So I'm just going to give another example, kind of thinking about this idea of let's go a little deeper and match the strategy we're using to what's happening. So here, maybe the distal outcome we're looking for is increased reach of service. We want to reach more of the population that we're working with. We have determined that one of the reasons we're struggling around reach and really having maybe high service utilization rates is that key partners are not referring to the service. So folks that we thought were on board, maybe in an early kind of planning stage of implementation, they don't seem to be on board. They're not referring, and we're really not able to get to those penetration rates in the population that we want to be able to get to change. So potentially we use a strategy that's more relational, that's about building the relationship, because maybe it's not that they need to know about the service. Maybe they just don't feel valued. They don't feel a part of it. They don't understand maybe where we're coming from exactly. So we want to support co-learning among all of the partners. And so we do maybe some specific activities that are about co-learning. And we think doing so, the mechanism for change is that it will develop a mutual understanding of how the service can contribute to positive outcomes, that we end up getting a shared mental model about moving the work forward by really taking the time to focus on co-learning. I have some incredible activities that support co-learning if anyone wants to ask about them, or I'm happy to send them in an email. And then maybe that's moderated by previous trusts that folks have had with each other, role clarity among partners. So, there's still some messiness that co-learning strategy could either, the influence of it could either be decreased or increased depending on that. But we think that getting to that level of mutual understanding, key partners will demonstrate greater commitment to providing referrals, and that would then increase reach. It's a very simple example for something that's incredibly complex because it has to do with people and emotions and all sorts of things. But I just wanted to make sure that we gave an example around strategies and outcomes that was less technical, because sometimes the work is really about relationships. So this, I think the slides go out. And so we just wanted to give you this as an activity that you could use with your implementation team to kind of do some puzzling around what are your determinant strategies, mechanisms, moderators, and outcomes. This kind of work will set you up for success and really make sure that you're developing, again, strategies that are aligned with what you need to accomplish. With that in mind, I know I'm running late, Christina, but I'm going to pass it to you to talk about your work, and then we're going to kind of pull these things together for everybody.
All right, thanks, Allison, and I think we're good for time. I am going to just take a few minutes to give you all a little bit of background on the work that's happening in Guilford County, so you have some context for our conversation. So Ready for School, Ready for Life is located in Guilford County, North Carolina. That's in the center of the state. It's a county with a diverse population of just over 500,000 people. And this is our mission. So Ready, as we call ourselves, is a collaborative effort to build a connected, innovative system of care for Guilford County's youngest children and their families. When we talk about collaborative, we're working with partners across sectors, so including healthcare, education, mental health, nonprofit agencies, public services, and so on. And the system of care involves proactively identifying child and family strengths and needs through a navigation system, and then connecting families to programs and services as early as possible, and ideally before smaller issues become entrenched developmental challenges. This is to address what families have described as a fragmented system in which children were growing up in the gaps between services they may have benefited from. Next slide. So at Ready, reducing inequity is a critical part of our charge, as like in many other communities, positive and negative outcomes in Guilford County are linked to race and to zip code, and we also experience significant residential segregation. Next slide. And so in working with our partners, we aim to create measurable change at the population level, both improving and equalizing outcomes, beginning prenatally and leading to kindergarten readiness, success in third grade, and beyond. Next slide. I'm going to spend a little bit of time on this next one. And so this brings us to Roots to Ready. And this is one of the central elements of our system of care, and one of the areas where Allison's Collaborative for Implementation Practice has been a critical partner. So Roots to Ready is a set of integrated services provided by 3 evidence-based programs and 1 locally developed program. And just as an aside, that locally developed program is currently undergoing evaluation in a randomized control trial with funding through the NIH. And this locally developed program was co-developed by the 3 evidence-based programs with guidance from other local, state, and national experts. These 3 evidence-based programs are Family Connects, which is a universal nurse home visiting program providing services in the newborn period. Nurse-Family Partnership, which is a long-term relationship-based nurse home visiting program for first-time moms that spans pregnancy through the child's 2nd birthday. And Healthy Steps, a program that embeds a child development professional in pediatric and family medicine practices to support those practices in delivering high quality services to families, and also to support families at the site with their child development or parenting needs. And the locally developed program is Community Navigation, which partners with obstetric and pediatric medical homes to connect with families to provide that comprehensive assessment of child and family strengths and needs approximately annually, and to support connection to Guilford County services that can help families reach their goals. So Roots to Ready is supported by a set of additional strategies which strengthen the system of care. And I'll just share a quick word about each of them. So there's a continuous quality improvement effort that provides coaching for local programs to use data and CQI processes, continuous quality improvement processes, to strengthen the quality of their offerings. A community alignment approach maps the landscape of services and addresses gaps. A public will building effort educates a range of stakeholders from legislators to business leaders, faith communities, and families on the importance of early investment. And an integrated data system supports coordination and communication across Roots to Ready partners to provide a seamless experience for families. And it also builds a foundation for community level analytics. So a moment ago, I mentioned the integrated services among the 3 evidence-based programs and community navigation. So these Roots to Ready partners have joined together to provide the coordinated navigation service as if from one program. And Roots to Ready is the shared brand that was developed to support communication around that. They've done this so that the program most convenient or accessible to a family, or the program with an already established relationship with that family, can serve that family. And to do this, each program has needed to modify its processes and adjust communication with families and other stakeholders. And that's one area where our implementation science practices have been focused. So now you know just a bit about the work we're doing in Guilford County, and we can get into some discussion on the barriers and facilitators to implementation that we hope will be helpful to you. So I'll turn it back to Allison.
Great. Thank you so much, Christina. I mean, the work's unbelievable. And so, you know, as we kind of go through those simple examples that I was kind of sharing, you know, we know that you're not using discrete strategies, you're using packages of strategies to be able to implement, scale, integrate evidence-based programming in Guilford County. But I have 3 questions up here on the slide that I think will kind of tie together that introduction, that long introduction I gave on strategies and the work that you're doing at Ready for School, Ready for Life, and specifically Roots to Ready. So the first is, how have you identified barriers to implementation of the expansion and integration of evidence-based programs in Guilford County? So as we think about how critical it is to truly understand our barriers, how have you all set about trying to identify those barriers?
Yeah, thank you. I think that's a really helpful question. And I think there's multiple answers, and the way we've identified barriers has evolved over time. So I would say that initially this was informed through what we learned from families and providers in Guilford County about how programs work together to coordinate services. Or really more frequently, how they don't work together. So we had a lot of data from a series of focus groups and interviews when Ready was launched, that Ready conducted with hundreds of families and providers. And based on this information, we anticipated certain barriers in working with these partners to expand and integrate. And those were things like the time needed for staff to participate on implementation planning teams, and competition between programs for funding and for clients. And so at Ready, we're working with cross-organizational implementation teams, each with their own priorities. And you may be dealing with cross-disciplinary teams in a single organization, or maybe cross-organizationally, but also with their own priorities. And so we were able to initially address these barriers with our teams in a couple of ways. I think one was through funding. We were fortunate that through the investment in Ready for School, Ready for Life, each of these programs also received funding to expand to their full capacity in Guilford County. And so this reduced competition across programs and it also allowed program managers, as well as representatives from the program's national offices, time to engage with design and planning teams. And I will say about that engagement of national leadership, that also addressed another barrier that we anticipated, which was the challenge of adapting national models that have strong fidelity structures to a specific local implementation. So the engagement of the national leadership really gave cover to our local program implementers to test new approaches. So that's one way. I think another early example of a strategy that yielded a lot of progress and kind of addressed that barrier of silos was orienting all of our conversation in our early design phase around what is best for families in our community. And the Roots to Ready programs really, those evidence-based partners, they're the experts. And, what they're hearing from families about what needs to change in our system is what we need to hear and learn from. And so this was an effective tactic at bringing the people to the table and generating new ideas. And it really was an effective tactic until it wasn't. And so that's, where I get to the fact that identifying barriers and really what the barriers were has evolved over time. So it's really, I think, been interesting to see that process unfold. Sometimes, and Allison gave an example about this too, that commitments that were made early in the process when we were in a visioning stage have needed to be revisited as we move to an action stage. So the stage in the process is really critical, I think, also in identifying the barriers. And I think that's okay that happens, because you're engaging that enthusiasm and motivation in those early stages. And when you get to that kind of action stage, putting it all into action, it is a different point in time. And the partners really feel more vulnerable when they get to the point where they need to ask their staff to do something different, and they need to change the processes that they're using with families or the processes that they're using with staff. So while we identified those barriers in the early days from a general understanding of what was happening in our community, when we were farther along in the process, we shifted to just really listening closely to our evidence-based program partners about what they need. So just as we listen to families in Guilford County to understand what works and doesn't work about our system of care, proactively talking to the partners and listening for barriers has really illuminated specific challenges for individual partners. In some case, maybe a concern about staffing levels or the time needed to implement a new process. And in some cases, we've streamlined those processes to alleviate this concern. And in others, we've actually adjusted individual partner roles.
Mm-hmm. That is so helpful. I want to just follow up on a couple things. One, I really liked what you said about kind of that barriers evolve across the stages, because I was going back to the Mentimeters that Michelle put up in the beginning, and is this content related to the stage that you're currently in your work? And I was thinking about that because the examples that I was giving around reach or fidelity or referrals are kind of assuming that some things are off the ground. But I think also a lot of this work is so, the identification of barriers is so applicable in a planning stage. And I love the fact that you said there are early barriers, and then there are barriers that emerge at another stage when people are like, oh, ooh, we seemed really excited about this, and now we actually have to do it. And that's a whole different barrier. So did you consciously think about the fact that as you move through different phases of implementation, that different barriers were emerging at each phase? Did you anticipate that basically?
I'd like to say yes, that we did.
I think you could say yes. No.
I think we reacted to it pretty quickly.
Yeah.
With support from some of your team. But I do think some of it we did not anticipate necessarily. So I don't know. I don't want to sell ourselves short. I think there were elements that we anticipated, but I think the piece that we did not anticipate was when you get to that moment, when you're poised on the threshold of, okay, we've talked about this, we've visioned together, we've planned it, we've created all sorts of tools to support understanding and training of new processes and talked about a coaching infrastructure to support that. And now we're really on that precipice of, we're going to do it. We're going to jump in, and it's something new. There really is a leap of faith that needs to happen. And I think that is the point when just a lot of questions surfaced that I think get to some of what you shared about the hidden levels of those determinants, and just the uncertainty of, okay, now here's where the rubber meets the road. And I think that's a really sensitive point in time. And so now I know that. And with future processes, we can plan for that.
That's great. And then the other kind of quick follow-up I had around this first question was, do you think that as you identified these barriers, how conscious were you guys of matching those strategies to the barrier? Do you know what I mean? When I was giving that first example where I didn't even show the determinant, I just said, oh, we want to improve fidelity. And we don't even know why we don't have fidelity, but we know that we're going to jump in with these fidelity check-ins. That's really common, to sit in an implementation team meeting, understand a challenge and want to fix it immediately. And so I just wondered, to what extent do you feel like there was a consciousness of this process of saying, what is our barrier, and can we draw a line between this, the strategy we're going to use to address that barrier and how we think that's going to help us get to better outcomes?
Yeah. So I think with the first example I gave about, the funding, that we were lucky on that, that was maybe just an obvious barrier. And that I think was well matched to certain pieces. I think we saw it as a silver bullet, and it doesn't accomplish everything that's needed. So I think that our understanding of specific barriers has become more nuanced, and that we've learned a lot about being able to match solutions to specific barriers over time. So I think we got lucky with some of the early ones, but again, they weren't matched in as intentional way as the work that we're doing now.
Right. Yeah. But that's great, I think, for folks to hear, is that, that it might have felt a little bit less specific and, precise. But as you've kind of become more implementation savvy, it's becoming more precise as you start to think about it. Yeah, that's really helpful. Okay, this next question, I shared that example of the consolidated framework for implementation research. And I just said, sometimes the challenge is about what you're implementing, the innovation, it's too complicated or people don't like it. Sometimes it's about kind of policy issues. Sometimes it's about organizational culture. Sometimes it's about how motivated people feel, what their attitudes are to doing it. There's all sorts of things it could be. So have you ever used an implementation strategy that you later realized was mismatched to the barrier? That you put resources into a strategy and then later had a light bulb and thought that wasn't the barrier? And could you give an example of that?
Yeah. Yes, absolutely.
Haven't we all? Exactly.
And I would say this is, it's a continual learning process. And I think the reflection and the ability to pivot is really important to this. So not just kind of barreling forward with what the first idea was and, seeing pieces of it fall to the wayside. You really need to reflect and adjust as needed. So I have a couple of examples here, a more concrete one, and then maybe a slightly more abstract one. So the first example actually comes from our continuous quality improvement work. And when we first began working with local programs, and again, our goal was to build their capacity to use data to drive decision-making, resulting in greater family satisfaction with their services. We thought the greatest need there would be capacity around CQI methodology. So, how to plan and conduct an improvement cycle. So we provided coaching that assumed a level of data management capacity already existed. And what we learned was that for some of these partners that we were working with, not all of them, but for some, their data management capacity was very limited. So they couldn't get to the point of planning and conducting an improvement cycle because that relied on data, because they didn't have the capacity to collect and understand and interpret that data. So, everyone's familiar with the idea of nonprofits working on a shoestring budget and staff who wear many hats, and, oftentimes data collection and management is not prioritized. We learned that we need to start from a different starting point with those partners and meet them where they are, provide some basic support on data management. And we also began to offer capacity building grants, which could be used as each program determined was most needed. So that could be as a part of their improvement process, what they learned through an improvement process, or it could be for basic infrastructure. And so that was an adjustment based on a shifting understanding of what the
barrier is. Yeah.
The more kind of abstract example relates back to the Roots to Ready partnership and that integration process, which in general, I think it's important to acknowledge this is complex work. It's been 2 steps forward, 1 step back, occasionally 2 steps back. Yeah. But even though it's challenging work, we've made considerable forward progress. And so at one point in that process, we realized that our collaborative implementation planning that the program managers were involved in was itself siloed within that implementation planning team. And their direct service staff was pretty much completely in the dark. Their organizational directors were also short on details. And so we identified the barrier as a communication barrier. And we developed a structured process to share key takeaways from implementation planning meetings so that information could filter both up and down across program hierarchies. And we provided support for the representatives on the implementation team to be able to share that back with their broader organizational teams. And when these new processes also didn't have the desired effect, we realized, and I would say through that, really proactive listening process that I mentioned earlier, that the issue wasn't really one of communication support needed, although I think people found that helpful, but it was really more about readiness and hesitancy to move from that ideating to changing processes. And so we're occupying that space now and working with partners to roll out and test new processes gradually over time, learn and improve what we're doing.
Yeah, that's so great. We're on the last question, and I want to ask you, so what have you learned about diagnosing barriers to implementation that are more or less visible than others? So I if it's okay, I just want to go back to this slide if I can. Sorry, you're giving everyone vertigo, I'm sure. Let me move you guys. There we go. This slide, I spent some time talking about the fact that, power and relationships and trust and people's mental models, that may be what's at play with the barrier. It may not have to do with resources or other things. And I just wondered, what have you learned about that, about diagnosing that, about testing out strategies that can possibly impact these things that are harder to see and that we don't often plan for in implementation, and we often don't research. Researchers, like I think we need more of that in the field of implementation science, like strategies that will address these things that honestly are often what's impeding efforts to move forward, but are not really talked about or strategized about or measured in any way. And I just wondered, what have you learned about that?
Yeah. I think we've learned a lot. I think the biggest thing that we've learned, I would say, is that piece about really listening to our partners without assumption, both for what is said and sometimes for what is not said or where it's not said. So we've tried to create safe spaces for partners to provide feedback. At various points in time, we've gathered feedback through anonymous surveys. We frequently use Jamboard, which is a Google tool like a virtual whiteboard, to elicit feedback, even during planning meetings where people can provide anonymous input. But we also want to, build that safe space where partners are comfortable airing concerns and questions without being anonymous. And we do seem to be making progress on that front. I think one of the things I was actually reassured with some of your slides around the, people staying through difficult conversations and things like that, it feels like we do have some of those elements going for us. But I think another piece that strengthens that for us is that for trust building is that back in 2020, we collaboratively worked with these same partners and some others in our community to develop a set of values and principles that guide our work.
Yes.
And so those include 6 values. We believe in being family-led, equity-driven, responsive to evidence, transparent, collaborative, and inclusive. And each value has a couple of associated principles that are more kind of action-oriented statements. And those are our collective values and principles. And so we do check-ins against those values and principles regularly during our implementation planning meetings on how are we doing against those? Where could we strengthen our work? And I do think this helps unify our partners in some way. And then I would say that in terms of diagnosing barriers, one thing we've learned is that it's easiest to look for those kind of concrete examples or infrastructure elements that may need strengthening. But we found that the barriers that are most important to address are those around trust and relationships.
Yeah.
And so while they're not always easy to diagnose because they're less visible, they also take time and intention to address. But I think they're really powerful if you can. And so, I was thinking about this, it makes me think about approaches and concepts like reflective supervision and parallel processing and things like that, some of the practices we talk about with families and frontline staff. And I think that these ideas apply in many ways in this implementation work also. So we also want to use a strength-based approach with our partners, and we want to build trust and authenticity, and we want to meet our partners where they are, and we want to approach our work with partners without bringing in assumptions that may be incorrect or biases. And we want to acknowledge that the work is hard. So we celebrate small and large wins along the way. And I think that helps us move forward together. And I want to say these questions were all about barriers, but I think we have had some powerful enablers as well.
100%.
So I hope we're not leaving people with an impression of the work floundering in Guilford County. Because it's not, but I think this has been an important part of the process to build that, to build toward success.
Yeah, I think that absolutely. And as I was thinking about, absolutely. So I can attest to the fact that work is on the move in Guilford County in trailblazing ways that are very innovative and exemplary in terms of implementation work. And I think you're kind of coming here and be able to talk about this is a gift, because everyone will face these types of challenges. And I think that we're talking about among partners, often we're thinking about how it is we deliver evidence-based programs and partnership, but it's also at the research practice partnership level. So as we partner with evaluators and researchers in our work, which I know you are partnered with MDRC, as a part of the evaluation for this, that the same values that kind of guide all of the work need to guide the partnership between the researcher or the evaluation firm and those who are really on the ground supporting implementation. And I would encourage our research partners, and this is work that our center is really committed to, measuring things like psychological safety, like level of trusting relationships, team cohesion. There are lots of quantitative measures to take a look at to really be able to understand what is happening and what those potential barriers could be. And then there are strategies to address those. So kind of incorporating some of that into the research design, I think is really helpful as well. Because as we think about those really standard implementation outcomes that folks want to achieve around acceptability and appropriateness and reach, these are things that are 100% contingent upon relationships, trust, buy-in, and people feeling psychologically safe to be able to participate and speak up in the work. So just want to note that as well. And I think that that's something that Ready for School, Ready for Life is 100% committed to as a partner. And as someone also funded around this work, I feel as if there are lots of safe spaces to talk about the work, including the evaluation part of it. So I think that's incredible. With that, I know we're a few minutes over, but I think we still have a little bit more than 10 minutes left. And so Michelle, I think I'm turning it to you for additional questions.
You are. I'm just gonna start first by saying thank you, Christina. You guys can hear me, right? I don't see myself, but you can hear me. Allison and I have a lot of, oh, there I am. Allison and I have a lot of conversations about the element of implementation science that is actually about leadership. And your presentation today I kept rethinking all the things we've discussed about you, like, to have gotten where you are, your use of self to be able to be a leader in implementation science in your organization was really apparent. So I appreciate that and just wanted to acknowledge that for you. Honestly, I'm telling my peers out there, if you have questions, please drop them in the chat. There were a couple, but quite honestly, through your discussion questions with each other, I feel like you answered them very thoroughly. So right now, I don't know that we have a lot of questions, but so let me just flip it a little bit, Allison. I had asked you if you could come in August and September, but of course you're very, very busy. So you can't make it.
I want to come. The dates.
I know you want to come.
I did want to come.
Yeah. So I guess what I wonder from you, and also Christina, I'd love to hear from you too, because mostly who's on this call right now are not researchers. Mostly it's CCBHCs and folks that kind of live in your space. But as people are preparing to write an NIH grant together, what is it that you would give advice around in terms of developing this partnership so that you can go through this together, if you have any thoughts on that? And Allison, my Allison, who works for me, not you, Dr. Metz, just dropped into the chat, please, to fill out the evaluation. So if my colleagues from that joined today could actually do that as we wrap up, I'd really appreciate that as well. So the question is about preparation to apply for an NIH grant together.
Yeah. Christina, I'd love for you to jump in too, because I mean, you have such incredible experience working as kind of in some ways the clinical or service side of this, even though you're at really kind of a backbone, but then also working with a large kind of research partner in this work. Something I would really love to talk about around kind of what I think of as research practice partnerships is really two things: encouraging folks to take a look at resources that indicate what are the activities of a really strong partnership. And those would be readily available through different venues, but I would really encourage folks to look at the William T. Grant Foundation's work around this. They have so much available on their website. And I think that sometimes we don't really, it's not visible what those constructs are. So I think when you think about an equitable partnership between a researcher and folks that are really doing kind of service delivery or on the clinical side of things, are that people give and receive in the ways that they anticipated. And so, we are often either giving or receiving in ways that we did not anticipate in partnerships, and that can lead to power differentials in the work that is not good for anyone. So I would encourage folks to take a look at what those best practices are for equitable research practice partnerships and include those. And I actually think that NIH would love to see a well operationalized description of the partnership. So exactly, we call them give gets in my world, but what are we each giving and what are we each getting very specifically around our aim statements? And, and that'll get into that detail around your data collection processes, how you're going to support communication around that, how will people be involved in the interpretation of data and the use of data for not just research purposes, but for formative and improvement purposes. So I would really encourage folks to have well operationalized partnerships with clear role clarity. I do think people often get points off in applications when the partnership and the roles are less clear. But I think at a deeper level, it has to do with equity and having an equitable partnership and really being clear about, do you have a shared mental model? Let's get to the invisible on what it is that you are hoping to achieve and to study together. And I think that everyone's going to have an agenda. That's okay. It's okay to have your own agenda, but you have to get to a spot that you feel fully good about, that you're each going to contribute to and focus on. Christina, do you want to jump into that? I know we just have a few minutes, but I think you have such good experience with that.
Yeah, no, I think what you said is so important. And I would just add to that, when you think about your team from your organization, just thinking with great intention about both the roles and the people who are participating on that team. So, what they're bringing to that team from where they're positioned in the organization and who needs to be involved to understand what's happening, what the process is going to be, what's going to change. All of those elements, who's excited about the work and who is passionate about this work, or who has more openness to change and can be a cheerleader for the work. And I think, one of the things we've seen across all of our work is that champions are really important. So I think that's a piece that would be worth considering. And then the other piece I would say is just listen to your implementation practice people about what reasonable timelines are. Yes. Because we were really overly optimistic.
Yeah, on the implementation practice side, we're disliked by both funders and researchers sometimes, because we're like, oh, just so you know, to get to those outcomes, we're thinking that's probably a couple of years, it's a struggle.
Yeah, it's a really nice way to end this webinar, because this conversation that you're talking about was really where we started, where, how do you even find a research partner that has the same values as you? How do you organize yourself to be ready to be in relationship in that way? So I love that you both made all of those comments and appreciate them very much. Denise dropped into the chat the WT Grant Foundation. And I would just say to our colleagues out there, I know we're talking NIH, but foundation grants are great too. And so philanthropy is not a bad place to go. And I really doubt SAMHSA would be that upset. But that's a way to think about it as too. But please look at those resources. I'm going to wrap us up. I thank you both so much for your time. We'll put this package together for the attendees and those who were not able to make it. The webinar, Allison, you volunteered some resources earlier.
We'll send them.
Yeah, we'll grab those from you. We'll get the WT Grant Foundation information for people, and you'll receive a document or an email from National Council with kind of the full package after. Give us a week, right? It usually takes a week. Yeah. So thank you all so much for attending. Please fill out your evaluations. Thank you to my friends and colleagues that presented today. We appreciate you very much. And we'll see you later. Bye, everybody.
Bye.
Thank you for joining this month's Learning Community session. Please take a few moments to complete the evaluation for this session using the following link being posted in the chat. We hope you join us again for next month's Learning Community session.